So my name is Christy Andrews, and I got into HBOT really because I did it for myself. And so as I started my own health and wellness journey back in 2019, I was able to do right at about 40 dives. And, then the pandemic hit, and that was kind of frowned upon, right? To have a bunch of people in the closed up chamber. So I kind of stopped my journey at that point. But what I realized is just after the initial 40 dives that I did for myself, my inflammation started to go away. It didn't come back. I started to feel really, really good. And then I realized, well, maybe I don't need to kind of continue, past these 40 right now. It was really kind of an interesting journey how I got involved in this because first of all, I truly believed in it. I truly believed in it. I saw how it worked for myself. And my inflammation was stemming just from having babies really close together. My back was thrown all out of whack. I felt like I always had a child on each hip. And my dad is also military. So my dad is Marine Corps and Vietnam. And so this opportunity really, I don't know any other way to put it, but that it fell into my lap. It literally fell into my lap to get involved in this and to do something really good. And I was just starting to return to work. And one of the sponsors of HBOT for Heroes is the Steel Network. And so I learned about HBOT for Heroes through the Steel Network. I had worked under that umbrella for quite a long time from home. And I thought this could be something that I could do really good with. And so my dad went through the program, and our program at HBOT for Heroes is fully funding hyperbaric oxygen therapy dives for our heroes. And the VA is not paying for it. Nobody's paying for it. And we know that it really does work for TBIs and PTSD. So we're looking at brain injuries. We know that when we just use that combination of oxygen and pressure, we can restore brain health. So that's really what we're doing here at HBOT for Heroes. And I have just seen it. We've treated over 300 veterans. So I've just seen it work over and over and over again.
I've heard a lot about HBOT and how it's helping veterans. And you mentioned TBI and PTSD. And I'm curious because a lot of those things are maybe hard to pin down medically, right? So PTSD, there's kind of a checklist, but a lot of it's on how veterans feel. Is there a way to maybe check, any kind of markers, blood work before and after to kind of see, I guess, clinically? Because we know it saves lives, but I'm just wondering, like on paper, what would that look like?
Yeah, so there's a few things that you can look at on paper. One is going to be, well, when you talk about a blood test, there's a new marker out that's called RNA. And RNA is going to help us. These RNA markers in our blood are going to help us be able to determine PTSD values and whether or not, when we combine that with hyperbaric oxygen therapy, if those markers are changing, if things are improving. I don't know a ton about it. It's something that we just were kind of introduced to. And is something that more on the clinical side that they're looking at. And we just recently, like I just heard about last week, being brought in to be part of a study for RNA markers where we can recruit veterans to be able to do the blood tests as well, combine that with hyperbarics, and be able to have more data. So that's kind of a big thing too that's going on in Congressman Murphy's office right now, is also looking at that RNA and looking at that value for PTSD markers to be able to make a little bit more of a clinical diagnosis on, those blood markers. Now, at the clinic that we work with, so we work with a preferred clinic here in Raleigh. It's called Extavita. And so what Extavita does is, because data is very, very important, right? Like we need to have data. We have to have it on paper. So A&M testing is a big part of what we do. We don't do SPECT scans or anything like that. We're looking at your cognitive executive function. So by looking at that and doing an A&M test, which is just a cognitive executive function test that's actually through the military. So most people have taken this at one time or another, especially if you ever were released, or you need to come back for service, I guess I should say, and they want to see if you were fit for service, you would take an NM test. Yeah, anybody who goes through our program, they do take that test at the beginning of their sessions and then post 40 as well. So that way we have a baseline and we can look at the end of it, in the improvement. So we do see about an 85% improvement, in those markers on your NM test. One of the big things that we do also look at when we're looking at brain health, we're also looking at how that's going to contribute to suicidal ideations, depression, anxiety, things like that as well. So the clinic also has and it's as standard as a PHQ, PD, the PHQ is a patient health questionnaire, 9. So it has 9 questions on it. And it's rated number 9 actually. Number 9 question is related to suicidal ideation. So this is all things that the clinic does. But I will say that when we looked at that value, and we put out our last impact report, it was a little over 50% reduction in suicidal ideations across the board from the veterans that did come to us and had suicidal ideations. Post 40, they were looking at over a 50% reduction in that. So there's different ways that they, collect that data and can see that on paper. But those testimonials are everything.
When you talk about things like fibromyalgia, chronic pain, PTSD, there's only so much that the medical industry, and specifically the VA, has to offer. And a lot of guys feel after years of trying that they kind of get stuck. And then it's like, what's next? So how do veterans in those scenarios get in contact with somebody who can provide this service? What does that process look like?
I will say that right now it's very state by state. And I say that because North Carolina was right on the heels of Oklahoma, and getting hyperbaric oxygen approved is an approval process. The state saying, okay, hey, we're going to approve hyperbaric oxygen therapy for the use of treating TBIs and PTSD in veterans. Once that's approved through a House bill, for us it was 2019 House Bill 50, then we received a little bit of money from the state. So that's kind of what we're seeing is happening, is the states are approving it as bills, and then there's going to be some sort of maybe like allocation of funds. I don't think any state has really seen the allocation of funds that it deserves. In Florida, you're looking at more of an allocation of funds for like I wouldn't say it's clinical trials. It's more like, I think in Florida, they're actually creating a treatment center, for veterans. Now here at HBOT for Heroes, we are a nonprofit. So we are a nonprofit, a 501c3. We will treat veterans out of state, but unfortunately we don't have the funding to be able to cover travel. We would have to use donor funds, of course, to treat. And it does cost $6,500 for us to treat one veteran with 40 HBOT treatments. So it's actually 65.52 to be exact. But veterans can absolutely, if they're out of state, can come here. And we do work with other organizations. Task Force Dagger is one. I just recently had a conversation with them, wanting to send somebody here. They're going to help out with travel and accommodations and things like that. So we do partner with those organizations, and we do everything we can to be able to bring that veteran into the chamber for treatment. Now, there are other organizations like Coterra. I've worked with Coterra on many occasions too, where Coterra, they have treatment centers across the country, really, and they're working with different people across the country. So I have had veterans who reach out to me, and there's no way they could travel here. It's not going to happen. So I have gotten them in touch with Coterra before, and we've made some magic happen for them on that level too. So I would say the first thing to do is, if in fact you're in a state, and it's, I think there's like 23 states now. I don't know the exact number off the top of my head, but I believe it's 23 states who have passed legislation to approve the use of hyperbarics for TBI and PTSD for our heroes. If you live in one of those states, I would say absolutely, just kind of look at it a little bit deeper on what are they doing? Who's getting behind this? There's probably some sort of nonprofit in that state who would be paying for it. We are the only nonprofit in North Carolina that is doing this at the capacity that we are. There are other nonprofits that are, maybe they're attached to different clinical networks that do have different systems in place. Maybe it might be a reduction in fees, could be free treatment. There's a lot of different things. I will say that there's a really great resource out there too that's called treatnow.org. And if you go to treatnow.org, they do have a list of treatment centers. I don't exactly know how accurate it is, but I do tell people all the time that is a wonderful place to start. Just start making phone calls of the ones that would be in your state and kind of see what they have available. If you were interested in traveling to North Carolina, or maybe you have family here, we get that a lot too. People who have family here and they're like, hey, I could stay, with my daughter or whatever. And that's exactly what my dad did. Then you can look absolutely at us at HBOT for Heroes and see if that's a good fit for you. And you would just go to our website, HBOT, the number 4, heroes.org, and just go to get treatment and fill out the intake form. And that's the first step in getting approved for our process. We have a pretty extensive wait list, though, so kind of keep that in mind. Our wait list stays about 3 to 6 months out.
I see. And you said it was about $6,500 for the whole treatment?
Yeah, so we pay at HBOT for Heroes, we pay $6,525 per veteran to receive all 40 treatments. That includes your consultation, the ANM testing before and after, and it also includes your breathing apparatus and those 40 treatments. So the 40 treatments of the hyperbaric oxygen therapy. Now, the one thing that we really love about the Extavita clinic is that Extavita does treat our patients in a pressurized chamber that is a hard chamber. So it's a hard shell, multi-place chamber that can treat up to 12 people at once. So it's usually a nice combination between veterans and civilians in there for a treatment.
Okay. So would you say that is about $12,000 because it's about half, right? So half donated, half cash at the 6,500. What is like the market rate for the service?
Okay. So I'm sorry, I don't want to confuse you. So is 65.25 is what us as a nonprofit pays. Those are some negotiated rates at Extavita, but actually at Extavita too, they do also, like, if you're not going to go through the nonprofit and let's say I just want to try it, I just want 10 dives or whatever it might be, they do have programs in place where on the clinical side, they are going to give you a 50% discount. So there are options to get each treatment as low as $75 at the clinic. We do pay the whole $150 here at HBOT for Heroes for our heroes. Okay. We've worked on a few different things with them where we've been able to kind of maximize that 50% treatment and then even pick up the extra cost. We're just trying to do everything we can to make it affordable for the heroes.
Sure. Yeah, I was just curious because if someone lived in a place where they maybe had access to something more local, but couldn't really commit to 40 dives twice a day for 20 days and the intensity, if they felt like it was worth their time and money to try to do it where they're at. I was just curious, like what 100%. They could expect.
I would absolutely look at treatnow.org because that treatnow.org actually lists the clinics. Extavita is on there. You're not going to find HBOT for Heroes on there because we're the nonprofit behind the scenes. But the clinic is going to be on there. And now if you were to call that clinic, they're going to send you to us as a nonprofit. So that's why I say go on there and look at the clinic list. And that is nationwide, and start there because a lot of these clinics, whether they're working with a nonprofit or the clinic itself is offering discounts up to maybe like 50, 75% off our heroes, it is a wonderful place to start and see kind of what's available. But I would say a lot of clinics, like because hyperbaric oxygen therapy is actually cleared by the FDA for 13 different indications. And if you go like for carbon monoxide poisoning, burns, drowning, there's a whole bunch of them that are on there. The bends, that's really kind of where a lot of people know hyperbarics from. In many cases, insurance would cover that because it's cleared by the FDA, but it's not cleared by the FDA for any type of brain injuries. So this is where things get very sticky in the sense that insurance is not going to cover it. The VA is not going to cover it. So you really kind of have to find those those clinics who understand this, see the benefits in it, and are willing to help our veterans make it affordable.
Okay. And of the 300 veterans, where are they at today? So I've heard that, pretty much, I don't want to use the word like cure, but pretty much, I mean, that's kind of the sense I get, right? They have PTSD, they're really struggling, they have chronic pain. From the stories I've heard, guys are coming out of 40, 60, sometimes maybe 80 dives, and that's kind of the end of it from what it seems like, right? Like no more of whatever was ailing them.
Yeah, exactly. And everybody's very different. What some person might see after 10 dives, it might take 80 dives. Because maybe we had brain injuries that date all the way back to Vietnam. We've seen that too. And so, yeah, we don't like to say the word cure either, because so much of it depends on what is your lifestyle like? If you're going to go into the chamber and you're going to do these 40 dives and you're going to leave here and start smoking and abusing substances again and not exercising and eating fast food 24/7, you're going to start battling inflammation again. You're going to spiral. So it's very important for people that when you leave this program, you are feeling good. It can be lasting results. Take care of yourself. And from what we hear from the average veteran who does come through us is that they want to take care of themselves. They have, and I think that that's what HBOT is really providing for them. They're feeling good. They're going to that next level where they're like, man, I know now what this feels like, that I don't have to live popping pills and being in a zombie-like state, whatever it might be. I feel good and I want to continue this. So I think it also drives our heroes to do better, to make better decisions. But there is a sense of actual healing that does happen to our bodies when we do hyperbaric oxygen therapy. So there's genes that are activated, activates over 8,000 of our genes. Inflammation is controlled. And the big thing that happens when we're looking at the brain is not only, stem cells are increasing, but blood flow is increasing. That's a really big one. Because now if we've had a brain injury, hyperbaric oxygen, the entire combination of oxygen and pressure can allow your body to grow new blood vessels to your brain and increase blood flow. So that's not a temporary thing. That is something that your body is literally growing because it's called angiogenesis, where your body is creating that new blood flow to heal the damaged areas. So, take care of yourself, and absolutely, you can see some very long lasting results. I did for myself, and I did have a brain injury. I have, but that wasn't exactly why I did it. But I mean, like, the big thing too about hyperbarics is if you can get into the acute stage. I use my son, for example. He got a concussion, and just knowing what I know about hyperbarics, I had him in the chamber like the next day. He only needed 3 dives. That was it. So any time that you have a brain injury and you can get into a hyperbaric chamber in that acute stage before it becomes a chronic condition, you don't necessarily need 40, So, every hyperbaric clinic is going to have a clinician there. They're going to help guide you. I'm not a doctor or a nurse, but that is from what the history has shown me. And the veterans that I talk to, I would say it's very rare that we have some that come back and say, we call them a tune-up. They say, I need a tune-up. You know what I mean? We will, in many ways, go up to 60 treatments. We will fund another 20 if they truly do need it. It's all based off the clinician and what she sees. But yeah, that's the big thing around. You can be, I guess, cured. I don't really like to say that word, but you can continue to live life so much fuller and with so much more clarity and so much less chronic pain and sleep. That's a big one that we hear about. You're actually sleeping after you do this.
I want to make sure that people are able to, get connected with you and find your website. So can you tell us your contact information so people can go there and either apply or learn more?
Yeah, absolutely. So the website is HBOT, HBOT, 4, and that's the number 4, heroes.org. So HBOT4heroes.org. And when you go on there too, you're going to see lots and lots. It is a fabulous resource. Okay, so not only can you go on there and you can get treatment, and you can learn a little bit more about how you can utilize the services of HBOT for Heroes to access 40 dives for yourself. And I say dives because that is the industry standard of what we call a treatment session. A lot of people do get very confused, but I think it's just habit, of saying dives. Actually got to the point where I have not been saying it as much because people are like, "What are you talking about? Like, were we in water?" So the 40 sessions, you can take advantage of that. You also will find on that website, you'll find my contact information when you go to About Us. I am one of the development managers at HBOT for Heroes, and we do only have 2 full-time staff members here. That is it. So we have me and we have David Buzzard, who David Buzzard is more of like our legislative liaison. He's the one who's working with the state of North Carolina and helping to really educate them and get more funding, for us, so we can take care of more heroes. But also what you're going to find on that website is you're also going to find our impact reports, and you're going to find testimonials. So make sure you check that out. There are testimonials from, so I don't even know how many are on there at this point. We have an amazing marketing team that's working with us behind the scenes, and they are just doing some incredible things with these testimonials and telling the stories that need to be told with hyperbaric oxygen therapy. And those impact reports, that's where you're going to find all that data that we talked about. So the A&M testing, the PHQ-9 reports, the suicidal reductions, all of that. That's going to be in the impact report as well. Oh, and we have a big fundraiser coming up, so you can check that out too, especially if you're local. We have our first 5K coming up in September. So run for their lives is what we're calling that, and that's on Suicide Prevention Saturday.
Okay. Well, I thank you so much for visiting with me today. And I know that a lot of veterans out there are eager to learn alternative health. And I encourage anybody listening to go check out the HBOT services, hit the website, check it out, join I don't even know how many guys. I know 300 with you, but there's thousands across the country who are doing this. And
oh, yeah,
incredible.
For sure.
Awesome. Thank you.
Thank you. Thanks for having me.